The next skill is called the scoop. And what we can do before we put a child under the water, we're gonna wanna start cueing them. And the way that we cue them is we're gonna take a little bit of water and we're gonna go 1, 2, 3, and pour a little bit of water on their head, all right? That lets them know that, get ready, hold your breath, we're getting water. Water's coming over the face. 1, 2, 3, okay? From there, we can start with the scoop. How you do the scoop is you're gonna hold your child in an underarm toe, okay? And it's gonna be more of like a just skimming along the top and bringing them into your shoulder, and they're gonna anchor onto your shoulder, okay? You wanna make sure you give them lots of praise once they get onto your shoulder, okay? You wanna make sure that you're also not jerking the child underneath the water like this, okay? It's not a dunk, it's more of a scoop, head first, scoop into the shoulder. Here's how it looks. Okay. Ready? 1, 2, 3. There you go, and lots of praise, lots of praise. You also want to make sure that once you start counting, you do it. If you start and go 1, 2, 1, 2, it'll fake them out. So it's important that once you start the count, that you do it. That was the scoop.
Next skill I want to talk about some tips and tricks about are the scoop. The scoop is a first-time submersion, so you want to make sure that cueing is a big part of this skill. When you're giving the cue to the child, you want to make sure that they hear it, they see it, and they feel it. So we always use the 1, 2, 3, and that's going to be your audio cue. You also want to make sure that when you're in the underarm toe and you're ready to do the scoop, you're giving a visual cue to the child with your face that you're about to take a breath. Now they're hearing 1, 2, 3, so they know to get ready. They're seeing you take a breath, so they know what you want them to do. Now how do you make them feel it? The feeling it is the lift. So you want to make sure that just before you submerge the child, you give a slight lift and then go into the water. The physical lift is going to cause a child's lungs to fill up with air before they go into the water. So every time you want to think about appealing to those 3 methods, and it'll look just like this. 1, 2, 3. That's how to do the cue for the scoop. Sometimes parents will forget the lift. When children are taking in water and parents are not sure why, most often it is because the lift has been forgotten. So when you take a child from here, 1, 2, 3, you can see how they don't have that extra second to take the breath after you've visually shown them what you want to do. The difference here is 1, 2, 3, and in. Okay? So the next part of the scoop is sometimes parents will go very vertical in a scooping motion. Notice that when we did the scoop just now, it was a very dipping sensation. It's a U shape. Oftentimes a common mistake parents will make is to put the child directly under the water and pull them towards them. This is something that's going to cause water to shoot right up the baby's nose, and it's going to push them towards you, like water rushing onto their face, which is a very uncomfortable sensation. This is often something that will also cause children to take on water, even if you're doing the cue correctly. Instead, what you want to tell parents to get their mentality out of this vertical submersion is tell them to make a stop sign with their hand. Now let's put our hand under the water. I want you parents to push forward as hard as you can. What this does is it lets them feel on their hand what their baby is feeling on their face. And when they do that and they realize that rushing sensation, it creates a different paradigm in their mind. All right, parents, now instead I want you to make your hand just like a stop sign, but this time we're going to dive your stop sign into the water in a U-shaped motion. How did the water feel that time? It flows across your hand, just like the water's going to flow across your baby's face instead of rushing them into the water. And that's going to help them to hold their breath better and to get the skill more comfortably. Sometimes some common mistakes that parents will also make with the cue is not committing to the 1, 2, 3. As you know, babies aren't always going to be paying attention, and maybe as you're learning the skill, they don't know what 1, 2, 3 means yet. So they may be crying or looking around, and when the mom starts counting, you get this a lot of times. 1, are you ready? Are you ready? 1, look here, and you're going to start the 1 over and over and over again. what this does is it gives the child the chance to realize that you don't mean business on 1, 2, 3. But in order for you to actually get them to hold their breath on 3, you've got to put them in the water on 3. So you want to explain to parents, when you start the 1, 2, 3, it's like running a red light. You can't decide to run a red light and stop in the middle of the intersection. You might have a car hit you, so you have to commit to the 1, 2, 3. So regardless if the child's looking around, if they're doing here, you're going to make sure you're using the cue correctly, and that regardless on 3 you go in. So it's 1, 2, 3. The other thing that you want to think about is if parents are looking scared when the child comes out of the water, it can often trigger a reaction in them that may not have been there if the parent looked okay. So a lot of times after the scoop, because the parents are nervous, they'll pull them up and look very scared, like, are you okay? Did that work? And it frightens the child. So before the parents do that, especially when you know that a parent is nervous, you want to make sure that you tell them, if you're afraid, I want you to make sure that the child's looking away from you and that you're just really close. Really close. The other thing too is you don't want to stand up and rip them out of the water after the scoop. That's going to be really unnatural. You want to stay low. And if you're going to look scared, let's don't make eye contact. Instead, let's give them a cue with our body. We want to tell them with our body that you're okay. Sometimes with your face, if you're not okay, then they won't be okay.